Inspector General of Nebraska Child Welfare released a report this morning. It included recommendations to the Department of Health and Human Services following several incidents. Channel 8's Veronica Barreto joins us from the newsroom with more. Veronica?
7 of the report's investigations involved deaths and serious injuries of minors in the foster care system, and they all happened within the last 2 years.
Part of the Inspector General's investigation follows the death by suicide of 3 youth in the state's foster care system. The investigation found that there is a gap in support and training provided to prevent suicide.
The way HHS had handled those cases didn't contribute in any way to those deaths by suicide, but what we did notice was more could be done and enhanced in terms of actual suicide prevention.
The HHS accepted the recommendations to provide continued training for staff working in foster care. Another part of the investigation involved the near death of a 4-month-old infant who was malnourished.
This child had a failure to thrive, so there's a very specific regimen of feeding that the child needed.
The report concluded the HHS was following its policies, but some protocols were missing under their current system.
But it left a gap where there wasn't one easy central place where everyone in the case can look to say this is what this baby needs at this time.
A third investigation was about the serious injury of a 2-year-old who consumed THC at a foster care home.
And we were focused particularly on the foster home that through a process within HHS had allowed the foster home to be overfilled.
These last 2 cases, the office recommended ways to verify home overfilling and procedures to report timely concerns.
And Carter says moving forward, DHHS will have a time period to implement these recommendations. Then she will be following up with them.
Veronica, thank you very much for that report from the newsroom tonight.